Good afternoon, everyone. I'm Mary Foley, Director General. I have the privilege to be Director General of the New South Wales Public Health Care System, and a very great system it is. I'd first like to acknowledge for this afternoon's session the traditional custodians of the land on which we meet, the Gadigal people of the Eora Nation, and elders past and present, and particularly any here present today participating in this very exciting symposium about innovation. I'd like to acknowledge Minister Jillian Skinner, the Minister for Health, whose initiative this symposium is, and who is passionately committed to innovation as a key part of what health systems do and what they need to be. I'd also like to acknowledge Minister Kevin Humphries, the Minister for Healthy Lifestyles and Minister for Mental Health, who will be joining us shortly and will be participating during the afternoon. And I'd like to acknowledge all of you, friends and colleagues, who are here participating in this forum today. We have a very exciting session coming up for this afternoon, I think, which I'm really pleased to be here to participate in. This morning I had to be at an ARMAC, Australian Health Ministers Advisory Council meeting, and wasn't able to join the morning sessions, but I've heard a lot of feedback as I've just been talking to people outside, and as I arrived in the car park and met some people who were having to leave at that point, and got a bit of a debrief about how it's gone. But I think this afternoon's sessions are going to take us a bit further into these issues of how do we ensure that we're a health system that supports, encourages and benefits from innovation. I think one of the key themes of today and will be celebrated in tonight's Health Awards is that innovation isn't just a nice to have or something that's the good but on the side, but an optional extra that is absolutely key to how we deliver healthcare and how we maintain ourselves and improve ourselves as an excellent healthcare system. The New South Wales health system is one of the larger health systems in the world. It's a very good health system. It has very good results. I'd commend to your reading some of the Bureau of Health Information reports that calibrate our health system against others in Australia and internationally, and we do very well. And when you reflect back, and we always hear these conversations, I mean, I've been around healthcare for, I was trying to count it up, probably over 33 years now, and I know many of you have been in it all your careers too. And we all do those war stories where we can sort of talk about 10, 20, 30 years ago, remember when we used to do X. And when you think back to how we organised and delivered healthcare over the last 3 decades, it's very different now to what it was then, and that's across all dimensions. I mean, the advances in health technologies that completely change the potential, create longevity, that we're all living to a more advanced age, and then facing new health problems and new challenges in terms of the shift to the burden of disease to chronic disease. These are all palpable demonstrations of innovation in our system, and that innovation goes from the big ticket medical research items that develop whole new cures through to the day-to-day nature of healthcare delivery within our healthcare organisations, both within hospitals and also in the community. And so innovation is a critical part of our health system, and is absolutely essential if our health system can continue to develop and become the health system it needs to be in the 21st century to address the challenges which all health systems worldwide are facing about how to organise the right models of care for the changing patterns of diseases, the challenges of affordability and sustainability, and the challenges of getting the right mix and design of services to bridge gaps and silos between different parts of care to organise ourselves around the patient and better outcomes for individual patients, using the best knowledge and the best evidence about what works and what's successful, and also innovations around empowering patients to be able to control more of their destiny as well in organising that care. So having a full day today to get our heads around innovation, to have the awards tonight where we celebrate real innovation right across our healthcare system is a very important part of acknowledging this process. One of the things I do know from my experience and my 33 years involved in all different parts of the health system over that time is that most of that innovation that you see, in fact, I'd like somebody to find me an innovation that doesn't come from there, that most innovation starts as local, whether it's the brilliant medical research idea, whether it's the nurse on the ward thinking, we could do this a bit differently for our patients. Wherever it starts, innovation is usually local and particular to particular patient circumstances and particular people at a point in time. And then something new is tried, and then if it's right and it works, then it spreads. And one of the things you do notice in healthcare that while we say, yes, we've got to get change, and that can be very hard in these large and complex systems, on the other hand, it's also interesting how quickly new ideas do get round health systems and how rapidly we do change models of care and practice. So we're this funny mix of leading edge at the one end, and then how do we change time-honoured practices that maybe we haven't reflected on that might need to be different, and how do we use evidence to guide us in that. From where I sit here as Director General and with my responsibilities, I see that from a system point of view, the responsibility from a system-wide perspective is firstly to create and support the necessary structures and environment that allow, encourage and support everyone in our health system to be able to be innovative. And then the other side of that responsibility is then, as innovation happens, that we also provide mechanisms to capture it and to disseminate it, exchange it, and then where an innovation is clearly scalable with significant benefit and applicability across the board, to provide the mechanisms for how we do that. And of course, the Agency for Clinical Innovation within our structure has a particular remit to support us in doing that, but also the Clinical Excellence Commission, for example, has already demonstrated a track record in doing this across areas such as between the flags, for instance, or some of the other innovative projects in quality and safety which it's pursuing. So I think as a system, we have a strong track record in this area. It is absolutely imperative as we develop our health system, notwithstanding all the other challenges we face, that we really have a priority to innovation. And today's symposium is part of that process, as well as various other initiatives, such as our new website, are designed to encourage at that system-wide level. But as I say, innovation begins with each and every one of us in our own spheres within the health system, and I firstly want to acknowledge that and say that we really appreciate that to be the health system that we are. It's a product of the sum total of those innovations to this point in time, and to acknowledge too that our commitment, whether we're introducing new funding systems or devolved models of governance or pursuing new policies in terms of particular processes that we require within our system, that in doing that we recognise that it is about supporting that individual approach to the patient and organising that care around the patient locally, because that's what it's all about. So I'm going to hand over now to Nigel Lyons, who's going to start us off for this afternoon's session and lead us into then what I think is going to be a very interesting panel discussion as a focus for this afternoon. Thank you.